A good place to start, I think often when we think about the end of life or trying to plan for the future, it's actually really a question about values. So these are really good conversations to have with family. I think often the best place to start is with a conversation. Sometimes it's even just bringing up the idea of talking about it more. That's a good place to start. And from there, it can be just talking about if time were limited, what would be most important to you. So if time were down to weeks, what would be important in that situation? If it were months, or even something like only days, just to understand and to share with everyone involved in your life what you would wish your plan to be, and then they can go from there. A great place to start in letting someone know what your wishes are is to just say, I think it's really a good time right now, when it's not a crisis, to talk about what would be important if I got really sick. And just see how that goes. Sometimes giving permission for people to be uncomfortable is important. But what that does is it lets them know that you'd rather not wait for a crisis. The best time to learn information, the best time to have good conversations is when there's no pressure. And so framing it like that you want to do it when we're relaxed and we can really think clearly is a good way to frame it. And by the same token, you can just say, I'd love to really know, because I care about you, what's important to you if you got really sick. I could see myself getting scared or anxious, and I would rather just know from you what you would want. So there are a couple of really important documents to know about. For all adults, it's recommended that they have a document that's called a healthcare power of attorney. And that lets you choose the person who would speak on your behalf if you lost the ability to communicate for yourself. So if you think about it, that can happen in a heartbeat. So it's not unreasonable for anyone to kind of make that clear in writing, I would like this person. So especially important for people with large families, if you can choose the person who you know will do what you want, will understand your values and be able to advocate for that. So that's the first document, the healthcare power of attorney. The other document is kind of a guide for whoever might end up needing to speak for you. And that is called an advance directive. Healthcare power of attorney is actually one type of advance directive, and the other part is called either a living will or an instruction directive. And again, that's a map of what you would want in some specific medical scenarios, some specific situations. So it lets you say, I'm the kind of person who would want to focus on comfort if I knew my time was limited, or I'm a kind of person who would really be willing to risk my comfort to maybe see if I could get more time. Everyone is different, and those documents really help us know, as your medical team, what's important to you. And again, anyone else involved in your care, like your family. The last kind of document to know about is something called physician orders for life-sustaining treatment. That's actually a bright green form here in the state of Washington. And the reason it's bright green is that's the one we use in emergencies. So while those other two documents can guide us and help us get more information about what a person wants, the physician orders for life-sustaining treatment are actually doctor's orders implementing your wishes. They're really sharing directly with any emergency responders what they should do in an actual medical crisis. So as you can see, those documents complement each other. It's okay to do one thing very early on, and then that practitioner orders for life-sustaining treatment becomes more important when you know you have a more serious illness, or often people who are in very advanced age want to make it very clear in real time what they do and don't want. So first of all, I think self-compassion is really important, especially during the time of COVID. This is a time when things that were hard before have become really difficult. It's a time when we're much more socially isolated. And just that is a major, major challenge for a lot of caregivers. caregivers are isolated to start with. So just to be aware, there are now a lot of online support groups. Being willing to kind of shift to those virtual formats is really important because no one can do this alone. I think a second idea would be, because things can happen suddenly with our elderly parents, it's a good idea to kind of have a hospital grab and go bag. So that could be something where if something came up suddenly, you could just have your medication lists for your loved one, a list of any medical providers who are involved in your loved one's care. Other things that are good to have is some hospitals allow you, Overlake does this, to bring in pictures of your loved one to kind of give them a human side. If they're really sick in the hospital, that's kind of a nice reminder for staff. Just other important medical contact information, like those advanced care planning documents that I talked about earlier. The last thing that can be really important during this time is to also consider planning ahead for future caregiving needs. So just because someone's been stable for 4 or 5 years, it's the reality that things can change overnight. And if you became sick, or if they suddenly had a decline in their function, the plan that was working for a long time is suddenly a complete disaster. And so we really encourage people to come in, talk with social work, work with our palliative care team. It's a way to be able to walk through some scenarios so that nothing catches you off guard. I think we as care teams in the hospital want to do everything we can to make sure we're still communicating with families. If anything, that isolation, that feeling of not having easy access to your loved one does nothing but increase anxiety, and we all understand that. So the keys are to go ahead and call, check in, find out what the latest visitor policies are, because those are evolving and they do change with what's going on in the community. The second thing is to be aware we've gotten really creative with technology. And so between the nurses who can be there at the bedside using phone services, also video assisted virtual visits with your loved one, we can do a lot. It's also important to remember if your loved one struggles with going between different languages, we do have interpreter services available and we can work with that as well. There's no reason to feel that your loved one is left alone because we have a lot of ways of working with that. Even before the pandemic, a big concept in palliative care consultation was to help families work with uncertainty. And the pandemic definitely illustrated that for everyone really suddenly, just how quickly someone's health can change, even young people or people who haven't had serious illness before. So I would say the heightened awareness of that within the community has actually elevated our visibility. We're having a lot more requests for advanced care planning or conversations about what it would mean if a certain person were to get COVID. So I think that idea of us helping families prepare for uncertainty has definitely been the biggest change. The other thing is, as the height of COVID caused some isolation for patients, their families, trying to visit them, not always feeling like they could easily get information. Palliative care has always been sort of a bridge between the treating medical teams and the people who care the most about the patient and who know them the best, their loved ones. So I think during that time when the communication wasn't flowing as easily, we were on the phone to families pretty much all day, every day, just making sure that things were clear and that everyone's concerns were being heard. I would say the last change that we've really noticed is the idea that families who've gone through COVID and now have a loved one who's going to need a lot more care, we're doing more and more to really try to map out a long-term plan. What happens after the hospital? What are the implications if the function isn't coming quite back as they were hoping it would? So there's a lot more planning ahead, a lot more need to address caregiving because recovering from COVID takes kind of a whole village, so to speak. And so doing a lot of coordination, doing a lot of long-term planning for those patients who are dealing with quite a lot. So with palliative care consultations in the clinic or in the community setting, what we do is after someone's been referred to us, we first start by reaching out to get a little bit of background by telephone. We just kind of go over the role of our team, ask how things have been going, what's working, what's not, find out if there are any concerns about the overall picture, if there are decisions that people are trying to make where they really just need a sounding board and a framework for making decisions for what's ahead. After that, we then kind of plan our visit. And we like to ask a lot about what symptoms people are having, what their goals are in terms of day-to-day function. What things do they love doing? What matters to them most? In the visit, after we've had a chance to talk about where we've been, we're then able to look ahead to where we want to go. So what comes next is usually making sure we have the right documents, as I talked about a little bit earlier. We do have a notary public on our team, so we can notarize those documents. Our physicians can sign the physician orders for life-sustaining treatment so that everything we've talked about in the plan is able to be carried forward, whether you're in a hospital, at home, or a facility. The other things that we can do are then connecting with other members of the care team to make sure that the plan and the person's goals are really first and foremost at the driver of any care that's going to be provided. So we're kind of a connector between different teams, and after the visit, we stay in touch to make sure things are working. And we've increasingly been doing video-assisted visits as well. So that's often a help for people who have had trouble getting out of the house during this time.